session that you are participating in is called Citizen Action on Public Finance Accountability for Inclusive Health. And we've added a section to this, which is using theories of action. Now, theories of action is a word that we use. We'll talk a little bit more about what this means. But very simply, what we are talking about is, given the nature of the problems that we are trying to tackle in our work, what are we going to do? What changes would we want to see? What are the range of things we could be thinking about in terms of influencing change across stakeholders who hold power?
International Budget Partnership, IBP, we work on issues of public finance, but also issues of governance and of citizenship and accountability, so the themes that are important to this conference. We work from kind of the global level with global institutions and doing surveys of kind of open practices by governments across the world, to supporting organizations at the national level who are engaging with government budgets, down to work at the local level and through our program called Spark. And I shared some of the lessons that we've learned in the panel this morning, so I won't go into them, but they're very consistent with the ideas and principles that are informing this symposium. So that's why we're looking forward to sharing with you all.
And we'd like you to see if you can get through the following questions and take notes, discuss with each other, introduce each other's issues that you're working on, and see if you can begin to knit together a little bit. Again, this workshop builds on the problem analysis work that we had done yesterday, but it gets to how we think about our theory of action, how we think about our theory of change, whatever word you want to use for it. And so for those of you who did not have chance to articulate a problem, if you happen to be with someone who had spent some time doing this, spend some time articulating your problem again and try to do it in 1 to 2 sentences. How does that problem impact a particular population? I think that makes for a good, strong problem statement. Second, what is a specific change that you'd like to see? So there are obviously a lot of changes that you will all be working on, given the issues that you're working on. We'd like you to focus on one. And for this one change, and again, thinking about in the background the role of budget processes in health services delivery, who are the key stakeholders that you need to be thinking about with regards to any action that you're going to take? So who's responsible? Who might potentially resist reform? That could be both those in an area of responsibility, or those could be other actors in the system. And who might be those who are supporting reform? Not just your organization, not just the coalitions that you work in, but the broader accountability ecosystem. That includes things like auditors or media or other sort of groups that maybe are beyond what a traditional reform coalition might look like. And then, if you could articulate, what would you like to see in terms of changes in the way that those stakeholders behave? So if you're a government unit that is not managing health funds appropriately, what types of changes do you think need to happen within that government unit? If you see stakeholders who are maybe community members who are feeling disempowered or unengaged or are not aware of the nature of what they're entitled to, what types of changes do you want to see happen at the level of those community members? And think, if you can, about how specific you can get. The more specific you get, the stronger the exercise is. And then finally, now that you have a map of the stakeholders who are relevant to the problem and the change that you want to see, how would you bring about change? And this is where I think this is where you'll probably spend a lot of time, because there are a lot of tactics you can deploy, but for every tactic you deploy, there are assumptions about why you think that might work. And there are other alternatives you could be considering. And so here's a space where we'd like you to reflect and think about how you'd be making priorities, given the range of changes in stakeholder behaviors that you want to see to have the right amount of change.
I'm just going to run through and give you an overview of budgets and the importance of using budget as a tool for civil society organizations. So the budget is a political document. It is political because it reveals the underlying priorities of the government. Every government in a democracy gets elected into power because it has a manifesto and they make certain promises. I'm sorry.
Oh, yeah.
Yeah, just keep pressing. Oh, great. Oh, thank you. Yes, please, thank you. Samir, could you please put that on slideshow? Like, okay, I'm really sorry, so I'm going to start all over again. So the budget is a political document because it reveals the underlying priorities of the government. Every democratic government comes into power making a few promises in its manifesto. And so how do we keep account of this? How do we hold governments to account? And we as a civil society, where are the points and phases of the budget cycle that we can influence? And where can we come in? Where can we share our inputs? Is extremely critical. So if you look at the budgetary cycle, everyone here knows that the budget is a document and it happens every financial year. That's over 12 months, but it's usually projections from any time between 2 to 5 years. So the key phases of the budget cycle, and this is across the globe, the nomenclature could vary, but this is the process. So there's a formulation stage, there's the enactment stage, there's the implementation stage, and then there's the audit stage. So what happens in the formulation stage? That is really critical because it's here that the government literally puts its money where its mouth is. And this is a really, really core and critical area of intervention because we as civil society, even though in most governments there are not formal processes to intervene, we can still intervene in the formulation process through non-governmental spaces, through creating our own spaces for people. Generally across the globe, the budget processes are very closed door. They're not open. They're not transparent processes. But we as civil society and the budget movement across the globe have said that budgets need to be open, they need to be participatory, they need to be people-centered. So just before the formulation stage, 3 to 4 months before the government starts preparing, before the budget is actually announced, that's where we can intervene and sort of do advocacy at various levels. Because even though the budget is a union government, or you may say central government or federal governments, depending on the structure of governments across countries, even though it happens at the highest level, inputs go from the grassroots to up. It is a bottoms-up process. So this, at various levels, we can influence the budget formulation process. So after the formulation process, when it's passed officially in the parliament, or depending on the setup in various houses, when it's passed officially, the enactment starts. And the enactment is when we can also influence, because we do post-budget announcement advocacy. So how do we do it? We, as civil society, sort of deliberate on what has been announced, and we say, are the allocations enough for the social sectors such as health, such as education, water, sanitation, the critical programs? Are the allocations enough? What has really gone into what? So that's also a critical moment. And then, of course, when the programs actually start getting implemented, this is where we as budget organizations collaborate with social movements, with NGOs. We do capacity building for organizations that sort of don't have the technical expertise. We track allocations. We say, this is what has been allotted for this scheme, for the health program, for the education program. How do we sort of track what is being, this money has been allocated, how do we track the implementation of this process? And then finally, after all these three are done, the audit process happens. And that's also a critical area because we can engage with the controller, auditor general, and see that this was allocated. There were loopholes. We all know about the loopholes in implementation because we know that at the service delivery level there are problems. But only when we engage with the entire budgetary cycle can we have, a comprehensive picture and a comprehensive engagement with government at different levels. So this is a key to all of us. It's important to understand in our own countries where are the critical points of intervention. Yeah, so the other thing, forget, that's all.
No?
So the most important thing is that how are we going to hold the government to account? We have to do advocacy at various levels like you saw, because the government, the budget is formulated to sort of, it has specific measurable objectives, and we are looking at equitable outcomes. So from the perspective of the marginalized communities, it's absolutely critical that we ask for transparent, open, participatory budgets. And in the course of time, we will sort of see where the problem lies. Where is the service delivery problem at the health sector? Because we're all working on health at different levels and degrees. How do we strengthen our evidence-based advocacy to deal and to engage with governments at different level? And how can we influence the discourse?
So I was very privileged to be sitting next to Dr. Janrose Ambruch she's the Director of Medical Services. In India, that's a big deal. And she was so transparent, so it's extremely good. And I was surprised to know that the problem she wants to be solved, and Nitin, you'll be very happy to know that she wants to solve it. She wants citizens to drive the agenda of medical health services. So if you have a person like her on the top, things are easy. And she also wants citizens to have strong participation in the budget formulation. She says that at the moment they are handpicked, people who come for that. They are given monetary incentives, professional people, and they are not interested or informed much. So what she wants is real citizens coming to the table for the decision-making process. And what is a specific change you want? Like I said, she wants citizens to drive the agenda. Very, very clear. She wants people more involved in planning, in implementation, and in monitoring. She's the one who's saying that we need the budgets to be monitored, and like people telling them why this has come for drugs and where is it going, tell me about it. And who are the key stakeholders? She says, of course, executives, like government people like her, media, citizens themselves, and civil society and NGOs, politicians. So these are the people she feels. And her main aim is that citizens are informed, basically. She says that there are several gaps in, what was the third question? Okay, so what are the changes each person, each level needs to be? And she says, unfortunately, power is put on one person. So the person doesn't share the budget, the person doesn't be transparent. And therefore, if you want to do anything or you want to find out anything, it's very difficult. It's very individualistic. And budget is never discussed transparently. If you want to do something, you have to really go and find out. And for example, she said drugs, how much money is for drugs or how much is in implementation? She said it's a very difficult, and she herself is talking of the executives who sort of, many keep close to their heart, and therefore, she says politicians are a headache. We all can almost, they continue to interfere with executive work. They demand jobs to be given. They contracts to be given to their people. This is not new. It sounded like India actually. And they think that the money which is available is their own money and they can spend it as they like for their trips, for their, going abroad here and there and everywhere. And they are not very transparent. And she says that citizens learn to demand. She wants citizens to learn to demand their rights, be informed about their entitlements, and media to inform about these rights. She wants civil society also can do education and information. I think we are doing a lot of this in India. And social accountability.
The discussion was on Ayushman Bharat policy, Pradhan Mantri insurance scheme, which is launched in last 2 years, and government is saying that we are covering 5 crore, 5 lakhs per persons in that. Coverage is 50 lakhs, no? 50 crores, sorry. 50 crores per people they are covering. So this is the policy. And now the budget is almost 12,000 crore for the insurance. So we have discussed about this is not actually what we want as a Indian people for the healthcare. So this discussion we had, and the finance related problem what we thought about, that if that money, if government can spend on public health system, it should be strengthened, and so many people can get access to healthcare through the public health system. So this is our main discussion point and policy change level issue. Then why we are thinking of that problem? So basically the policy is focusing more on secondary and tertiary healthcare services. So people need primary healthcare also, and secondary care is also important, but mostly tertiary care and whatever the surgeries which we normally we don't think that they are covering in that. So this is the issue. That's why lack of care to the all people. This was the basically main issue. Then coverage of overall population, because they have chosen the SC/ST census list, but many people who are like vulnerable, they are not in that list, so they are excluded. So this is the situation, and that's why and the second thing is approach of the government is to give insurance to the people. So like you will get the card and then government's responsibility will be finished. So this approach is a problematic. We are saying that we need all kinds of healthcare facilities at any hospital. So this is the our point of view to oppose the policy. And then so when we discuss how we will change this policy, so we have think about that we will do the evidence building. So how the finances are going to the insurance companies and what they are actually making profit out of the money, and actual beneficiaries who are lacking behind. So this is so this kind of evidence building we will do, and then through that we will demand our policy change. And so basically in that whole exercise we have thought about the stakeholders also. So basically the stakeholders will be the patient rights group, including HIV positive, LGBT groups, women sexual reproductive health related groups, Safai Karmachari, clinical cleaning workers, then workers union, farmers union. So this kind of whole different kinds of group we will think that they can be stakeholder. Then like JSA, Jan Swasthya Abhiyan Movement Forum, So that can be one of the ally. And also there is a problem of corporatization and the profit making through the corporate hospitals. So some of the sensitive doctors who work in the corporate hospitals, so they are also ally for this kind of things. So rational doctors who think towards the people, so they can be the ally, so they can come with this group. And also we can influence some sensitive MP MLAs also.
And I work with an organization called Community Empowerment and Development Center. This is an organization that works around governance processes in Kenya. And we work around civic education space to ensure that we have transparent, reliable budget that responds, government budgets that responds to citizens' needs. And then I want to share something small about what we do. And basically I'll be basing my sharing, because of the limited time, on the strategies that we employ to do this particular work that we do. So one thing that we realized is that in Kenya health budget, because Kenya it has a central government and then divided into 47 counties that we call them subnational governments. So we have the national budget and then the subnational budgets. So in the subnational budgets as well as the national budgets, one thing that we came out strongly and then we saw as an issue that we wanted to follow up and see how it's behaving is there's a lot of allocation in terms of health budgets that receives the huge allocation of the country budget. And then the same thing does not translate in what we see on the ground. Again, you realize on the ground things are different from what you see in the documents in the papers. So that again pushed our effort and our interest to start and understand what's happening around budgets that are not realized on the ground. And one thing that came out strong was even at the subnational levels is the difference, the difficulty in accessing budget information or budget documents at subnational levels. So budgets that are not transparent and reliable, you can't count on them because again, they don't translate on what we see. And one thing that we went specific to see in health was in issues of so many incomplete projects, and a lot of maternal deaths that are caused because of lack of essential commodities in this particular facility. So we went down to narrow down to what we call the levels 1, level 2, and level 3 facilities. These are the home, this community health at the community level, the ones at the dispensaries, that's level 2, as well as the health centers. So that is our area of interest, again, because that's where most of the most marginalized people are. And then one thing that we realized that we have so many good policies and so many laws. Even the Constitution, Article 43 in Kenya law, articulates that health is a basic need and is a need that has to be provided in highest attainable standards. And then why is it not reaching on the ground? So one of the strategies that we did was basically, first of all, to start providing knowledge to the citizenry. How did we do that? One thing that we did was to map up some of the few facilities that we can use as samples to ensure that then the information that we get and anything that we do around this is able to replicate to these other 62 facilities within a specific set area that we were working on. And then we did what we call budget cafes. Budget cafes, this is bringing people that use services around this particular facility, then have health interest. So we discuss with them matters around health. They are able to identify issues that are affecting the health services at a particular facility, and then put them in terms of priority. Which ones are priority? For instance, something that was coming out strong was issues around lack of essential commodities like drugs in these facilities. Under staffing, you get a facility has 1 or 2 staff and all of them are nurses, not even a clinical officer, not even any other profession. And then we realize there are so many other incomplete projects, like there's no maternity wings, there's no maternity services in this particular facility, so how will deliveries be able to be done? So then that one leading to a lot of maternal deaths in these particular facilities. People now start using the private facilities, where again, some of them are manned, but people are not a professional. So these are things that we wanted to see further, how they can be cascaded and be able to reflect in the budgets, and what's the government response towards these particular issues that were coming out strongly. So one thing that we did after they conducted the budget cafe with the citizens around this particular specific area, then we identified again as a collective agency, all of them might not be interested into this. And all of them might not be leaving their time to ensure that they follow up the process. So what we did, we came up to narrow down a bit to get few people that we call them budget advocates or the budget champions. So the community members selected amongst themselves 10 to 15 people that we are able to give them capacity in areas around understanding the budget cycle, the budget process, the way Priyanka has explained. It works the same as how it works in Kenya. And then they are able to understand the budget cycle, budget process. They are able to articulate and interpret budget things, the information in the budget, and then be able to come up with what we call information package, share with the people about how the budget cycle works and how they can plug into the budget system, and then be able to, how they can bring the challenges, these issues that are in this particular health facility to be plugged into the budget system. In terms of we want medicines. So this is the time when we can start pushing the government to ensure that medicines are available. We don't want staffing.
So in our case in Guatemala, we, if we remember the cycle of budgeting, we try to focus more in the human aspect of that cycle. That is the people, the person that do the budgeting. In Guatemala, the health budget is built up from bottom up. So the local levels prioritize and schedule the year planification. In the year planification, they put their need, their activities, their different job they do, and they put the budget they need. So the thing is, in Guatemala, there are a lot of corruption and nepotism in hiring. So much of these officers that do the budget are doesn't have the capabilities needed to do that job correctly. So what we do is we focus more on monitoring key elements in the process of the administrative process of building up the budgets to make sure that the budgets they build up are good and really help to have a strong health services, and they're able to provide the quality that the person needs. So one of I think I can say that there are two like strategic approaches we do. The first one is empower local community leaders to empower them in basically in the rights, in the political rights, in the right to health, but especially in one article of the law of the law of health. So that article is the article that give the communities the right to participate. So Guatemala has a very progressive legal framework, but the thing is, like, most of the people doesn't know what are their rights. So according to our law, there are 5 kind of topics in which communities have the right to get involved. So those are planning, organizing, directing, executing, controlling, and fiscalizing the health services. So like you see, it's very, very strong, the participation that people can have. So with that in mind, we again, we train these leaders and we explain them what they mean these rights in the more concrete level, and then we try to build up accountability spaces with the different authorities in the local, regional, and national level. In the national level is very difficult, and because we are trying to empower people and get people engaged in accountability actions with the authorities, we focus more in local and regional level. And the idea of that is that making sure that local level has good a good planification with the right funding means that they will be able to provide more or less good services to the people. So then we have kind of 6 steps we take. We'll be very quick. Okay, so kind of a 5-step we take in this process of mapping the administrative process. One is identify who are the main stakeholders in the process of budgeting the health services. Then which are their responsibilities, and roles. Another, how are the decisions are made in this process. Another, what is the normative of the process, if there are any normative or there is needed to implement one normative, and then it's building an action plan to monitor and monitor the bottlenecks in this process, to try to open up that bottlenecks and make sure that the resources that go to from central level go the more like fluid to the communities and to the health services that the people are needed.
Just a couple of broader reflections about kind of doing these kinds of processes first. I think one of the things that's come up for me in several sessions over the past few days is that in the healthcare kind of space, the problems are really multifaceted. The health systems are complex, and there are, I mean, particularly when we're talking about quality, equitable, and inclusive services for marginalized populations, the gaps are many, and the causes of those gaps are also many. So that means that our strategies need to be holistic. But how do we go beyond kind of long lists of activities and that are based on implicit assumptions? And you know, in the past, or in many cases in the present, particularly if we're working in a space where we're receiving external funding, we may be working in kind of a project logic, which is pretty linear. It's cause one equals effect two. And how do we kind of square that circle with a systems perspective where there are lots of things happening, there are lots of causes, lots of effects, and we need to be understanding what other actors are doing in the system and how the work that we are doing might intersect with them, both so that we don't kind of duplicate things, but also so that we don't leave gaps between an area that's being worked on over here and an area that's being worked on over here, but nothing in between. So I think that suggests that there's a real value in spaces for shared kind of problem analysis and strategizing, so that we're working from a common kind of diagnosis of the system. But each kind of actor who's trying to achieve change can do so in a way that maybe finds some synergies. But it also means that there's an opportunity to really kind of look at these problems and causes and map kind of different approaches on top of them, and then do what we did here, which was to drill down to the level of individuals, because so often we think about what decision makers or service providers or other actors in the systems, you know, will do, or we hope that they will do on the basis of what action we are taking or our allies are taking. And we really need to kind of run that logic through and make it very explicit. So if we think actor X is going to take kind of action Y because we do Z, we need to kind of say on what basis or with what assumptions are we making that? Just because we informed them that there's a problem, or just because we citizens engaged them in the formal spaces? Why do we think that's kind of enough to make a difference? So again, much of this is just about kind of surfacing our logic so that we can both test it before we go out and do something, and hopefully test it both with ourselves, allies, and with people who might disagree with us, so that they really press us on the assumptions that we're making, but also so that we have clarity on why we're doing what we're doing, so that as we go through and the situation changes, or we start to see some results or don't see results, we can come back and say, well, why isn't this working, or why isn't it working the way that we thought? If we didn't make it clear what our logic was, then we have to kind of reconstruct things from scratch, or kind of pick answers out of the air. So having something solid to go back to is really important. That said, we can't just sit around and do problem analysis and strategy all day, as much as me and possibly my team would like for us to do that. We have to do good enough analysis. We have to spend some time, get as far as we can get with what knowledge we have, and then go out and test those ideas in practice, come back and take stock and change course if needed. So I think all that we were talking about here today sounds like a lot of those processes are happening. A lot of good thinking has happened. A lot of experience has happened. A lot of reflection has probably happened. A lot of iteration has happened on that basis. So that's really useful for us to hear and encouraging as well.